I'm Dr. Osama Muhammed Amin, Senior Consultant, Board Certified Neurologist and Fellow of the Royal Colleges of Physicians of Edinburgh, Glasgow, London and Dublin, as well as the American College of Physicians. I'm also the author of several books that deal with the MRCPUK and MRCPI examinations. Quite a few people have been asking me lately about one of my books, and that would be this one. Neurology Self-Assessment for MRCP UK Neurology Specialty Certificate Examination, SCE. The book is quite large, features 1,000 plus questions in a different examination format. And it covers almost all of the topics that you may encounter in the real examination. However, the book is not intended and was not intended to imitate the real examination. No, the idea is to self-assess yourself. Read accredited textbook or textbooks first, and after then try to self-assess your knowledge, your background knowledge, your foundation knowledge. Where are the gaps? Where are the defects? What have I been missing lately? Updates in guidelines, updates in treatments, updates in novel diseases, and so on. The book features 5 chapters. Chapter 1, I think, is the most important one, is the largest one actually. It has several questions in a best of 5 format. That would be, you should choose one stem out of 5 stems. Best of many, and that would be 2 to 3 correct stems out of 10, and a single line answer. You will be encountering a question with several sub-questions in the form of a single line answer, a blank space that you should fill in with your answer. Yes, in the whole world, there is no such an examination type or mode, ever. It is just to teach you. It is a mode of teaching. Chapter 2 targets the most common and most updated themes in neurology or topics in neurology. Updates in the guidelines, novel diseases, novel treatments, newly approved medications for Alzheimer's disease, for motor neuron disease, new treatments and modalities in multiple sclerosis, and so on. Chapter 3 is the commonest examination themes that you will be encountering actually. Chapter 2 and 3 were taken from my other books and from my what I call crash MRCP courses that I have been conducting over the past several years. It is a mode of teaching others. I have collected these questions and made chapter 2 and chapter 3. Chapter 4 is in the form of true-false format. There is no true-false format in the MRCP examinations, ever. It is just a rapid review. The idea behind writing or drafting that chapter is to make a rapid review in your background knowledge, starting from neuroanatomy, neuropathology, neurophysiology, clinical features, etiologies, and so on. Chapter 5 is what we call photographic materials, an image or images of brain MRI, plus minus contrast, brain CT scan, an MRI of the spinal cord or the spinal canal, an image of EEG or EEGs, many types of EEGs, several images of true patients, of genuine patients, that for example, a facial weakness, and likewise. The book is, I think, yes, quite maybe expensive because it is a large one and it is in color. And it is published in North Carolina in the United States. The book is very friendly to read, and you can approach it very easily. The questions are quite obvious. The writing and the drafting are very user friendly. The photographic materials at the end are in color, should be in color, and I will show you some of the, for example, that is a hand of a patient and that is a CT scan. Neuro-ophthalmology also has a good share in this book. Some books actually deal with the psychiatry. I have been informed that many examinations have contained some sort of psychiatry or neuropsychiatry questions. And therefore I have included some, especially the updates in some treatments. You may encounter some. Anyway, if you have any question, please don't hesitate to contact me. The book is only available from the publisher. That would be lolo.com in the United States of America. If you have any question, please don't hesitate in contacting me. Any feedback is quite helpful to me. And thank you. And I wish you all the very best in your career and examination. Osama.